So, breast cancer touches the lives of millions worldwide, and here in Malaysia, it remains the leading cancer affecting women. With 1 in 90 Malaysian women at risk, early detection is more important than ever. But awareness is more than just knowing, it's about prevention. Today, we are here to share knowledge, inspire change, and empower you to protect not just yourself, but also the people you care about. Together, we can raise awareness, foster hope, and work toward a future where breast cancer is no longer a threat to our communities.
Breast cancer is a type of cancer that occurs when abnormal breast cells grow uncontrollably, forming a lump or tumor. Biological studies confirm that breast cancer is the result of an accumulation of a large number of individual genetic mutations that collectively alter elements of the complex internal signaling system of a cell. There are two main types of breast cancer, which are invasive and in situ.
Breast cancer can occur in both men and women, but it's more common in women. In Malaysia, breast cancer is the most common cancer among women, accounting for 32.9% of female cancer cases. Approximately 90% of all cancer patients in Malaysia have breast cancer. Notably, 13.6% of Malaysian women diagnosed with breast cancer are under the age of 40, compared to 5% in the United States. Meanwhile, male breast cancer is rare, representing approximately 1% of all breast cancer cases globally. In Malaysia, a study shows that about 1.6% of breast cancer surgeries involve male patients. This indicates that while breast cancer predominantly affects women, men in Malaysia are also at risk. While the chances are low, the risk is never zero. This underscores the importance of awareness for both genders.
We have to know the risk factor of the breast cancer so that we could prevent the disease and we could live our life. Breast cancer has two types of risk factor. First of all is the factor that cannot be changed, such as age factor, gender, and family history. First and foremost, women are at much more higher estrogen and progesterone hormone level, which can stimulate their breast cell growth. Men can develop the breast cancer, but it's much more rare compared to women, since that they have lower level of estrogen and progesterone. Next is age factor. The risk increase as you get older. Most of breast cancer patients are diagnosed in women over 50 years old. As cell age, they accumulate more mutation, increasing the risk of their breast cancer. Other than that, as someone that have close relative that has breast cancer, your risk is much more higher. The risk is even greater if multiple family members had it, especially at a young age. There is also a risk that can be changed, like obesity. Being overweight, especially after menopause, will increase the estrogen levels. Fat tissue produces estrogen, which can promote the breast cancer growth. Apart from that, for people that smoking, you will be exposed to a higher risk of breast cancer. Smoking is linked to a higher risk of breast cancer, especially in younger women and those family with history disease. It also increases the risk of complication from breast cancer treatment, as smoking weakens the immune system, making it harder for the body to detect and destroy the abnormal cells. It's also reduces the antioxidants in our body, which normally help to prevent the cell damage. But don't worry, we could decrease the risk by having a good lifestyle and a balanced diet, as well as we are creating a better life for our future.
The exact cause of breast cancer remains unknown, but scientists have identified multiple factors that can trigger the abnormal growth of breast cells. Mutations in DNA, hormonal change, or exposure to certain chemicals may trigger this abnormal growth. At its core, breast cancer begins when cells in the breast undergo mutations in their DNA. These mutations disrupt normal cell function, causing uncontrolled division and the formation of tumors. So, tumors can be benign, staying localized, or malignant that spreading aggressively to nearby tissues. Malignant tumors can even travel to other parts of the body, making breast cancer life-threatening. Understanding how this tumor form helps scientists create treatments that target the root cause and save lives of the breast cancer patients.
Morning, Miss Fatin. How are you feeling today?
Good morning, doctor. I'm not feeling well today.
Oh, what's wrong? What happened?
Doctor, I come here due to I have a new finding that last 2 weeks, and I think this is unusual for me. I noticed that near my breast and in my underarm have a lump and thickening like a skin irritation and distortion. I think that my breast also changed in size and shape. And the color of the skin also turn redness. I noticed that the nipple discharge, tenderness and inversion, which mean the nipple is pointing inward. Is there anything happen?
I understand your concern, Miss Fatin. So to confirm your symptoms, we will have to perform a clinical breast exam. So this physical examination is to perform on the breast and then to see whether there is changes in the skin or maybe to check if there is any lumps within the breast or in the underarm. That is usually common. And then let's say if there is any lumps within the breast, then we will go for two kinds of scanning, which is mammogram and MRI scan. So you have to know that mammogram is for average risk of breast cancer, and then for the MRI scan is for high risk of breast cancer. So then I will emphasize on MRI scan because you said like something is so severe already. So then MRI scan is usually to lead us to a more detailed pictures because we use magnetic field and radio waves to create a clear picture for us. So then before the scanning, then you will have to receive an injection of dye. So this dye helps the tissue to show up better in the image lah.
Is there any other option, doctor?
Yes, Miss Martin, there is another option which is biopsy. So biopsy is a procedure where we will remove a tissue sample from the breast. So how this procedure is taken is where we will use a needle through the skin and then into the breast, and then after that guides the needle using x-ray or any imaging techniques, and then once we reaches the right places, and then we will draw out the breast tissue, and then at the same time the marker is also placed. So this marker is to show up on the imaging test so that we can further monitor the area of the concern. And then once we get the tissue sample from the biopsy, so this tissue sample is go for lab testing. So after a few tests in the labs, and then we will determine whether what type of cancer or how fast it's growing and then this leads to how we stage the breast cancer lah. So we know that there is stage 1, stage 2, stage 3 and stage 4. So how we stage the breast cancer is through two kinds of tests that I will emphasize. So one is blood test, and then second one is positron emission tomography, which is also called as PET scan. So PET scan is more accurate than MRI and CT scan because it detects areas of the breast cancer throughout the whole body. And then it can also detect the distant metastasis.
So what should I do?
Okay, Ms. Fatin, for your treatment plan, usually some people will go for chemotherapy or hormone therapy before the surgery. So basically this helps to shrink the cancer and easier to be removed during surgery lah. So usually breast cancer surgery have two, which is common. One is lumpectomy, one is mastectomy. Lumpectomy is usually to remove some breast tissue and the healthy tissues around it. So this is used to remove small cancer. Then while mastectomy is the opposite, where we will remove all of the breast tissue from a breast, and then this is used to remove large cancer. Don't worry, Miss Fatin, don't look so concerned yet. Usually after the surgery, we will take precaution as well. So we recommend hormone therapy. So hormone therapy is usually we will give you a medicine to block certain hormones. So these hormones are usually estrogen, progesterone that acts as a fuel for the breast cancer to grow. So that's why we use this after surgery to prevent any breast cancer from coming back lah.
If you are a woman, you have 1 in 8 chance of getting breast cancer during your lifetime. In early stage, there may be no symptom of getting a breast cancer. But as the cancer grows, there are changes that both men and women should take it serious. The first symptom is a lump or thickening, such as swelling, skin irritation, or distortion in or near the breast or in the underarm area. Other than that, a change in size or shape of the breast and a change in color, the color of the skin of the breast, areola or nipple. It might be a dimple, puckered or scaly. You may notice nipple discharge, tenderness or inversion, which means the nipple is pointing inward. Or sometimes they also has a abnormal or fluid flight from the nipple. People with an abnormal breast lump should seek a medical care. Even if the lump does not hurt, if you have a new finding that lasts 2 weeks or longer, and that is unusual for you, you need to find a doctor. With early diagnosis, there is a 98 chance of surpassing the 5-year survival rate. Different people have a different symptom of a breast cancer. So if you have any sign or symptom, be sure to see a doctor right away.
According to the World Health Organization (WHO), breast cancer is the most common cancer worldwide, affecting millions of people each year. To combat this, the WHO Global Breast Cancer Initiative (GBCI) aims to reduce global breast cancer mortality by 2.5%. Achieving this goal requires a strong focus on early detection, timely diagnosis, and effective treatment. Additionally, adopting preventive measures such as maintaining a healthy lifestyle, regular screening, and increased awareness can significantly lower the risk, strengthening the global efforts in education, research, and healthcare accessibility will play a crucial role in reducing the burden of breast cancer to save more lives.